Hello all. Since we have just talked about the resources that I've used, I'll add up a few more points regarding solving MCQs. Because solving MCQs is not just about knowing it all. It's not just about, having an in-depth and broader understanding of a concept. It's also about that knack of doing MCQs per se. So you have to be in practice, you have to keep doing questions. You can't just keep the MREE past file open and just simply randomly scroll it through, because that'll give you an idea. That'll give you an idea of how the questions are going to be framed. That'll give you an idea of how you approach a question, but that'll definitely not improve your MCQ solving skill. You have to keep solving MCQs for that matter. So let's get to the point of how to solve MCQs, or the art of solving MCQs. So when you approach a question, an MCQ, especially from MREE point of view, I'll say that there are mainly few kinds of questions that come. So whenever you prepare for an exam, you have to understand what they're expecting out of you. What are you supposed to learn, and what all you are supposed to perform on the exam day. So you have to know whether there are going to be negative marks, how the markings are going to be, how much time you get for that exam. So as far as MREE is concerned, you're going to get 120 questions, 3 hours, that is 180 minutes. So you're going to get, I think, roughly around 1.5 minutes per question. That's too much, and that's enough to be said to solve one MCQ. And on top of that, you're not going to have any negative scoring. Okay, once you have this in mind, you know that you have to attempt all the 120 questions, because you're not going to have any negative score. So you have to give it all and then see what comes as the score. Also for MREE, your scoring is based on your percentage, that is how much you have scored out of 120, and your percentile, so how well you have scored when in comparison to the other participants who have appeared for that same exam. Okay, that is your percentage, percentile, and your number of attempts. For example, if you are appearing for this cycle 2025-2026, wherein all the 8 dates are already announced, if you are appearing, say for example, on December 21st, the very first lot for MREE this year, and in case you didn't get the cutoff score, which I think is around 55-60%, that means you have failed the exam. But you will be given 2 more attempts in the same cycle to appear for MREE. But what happens is you have to reapply again, you have to pay the fees again, you have to make arrangements to be there in UAE again. That's all one side of the matter. But your scoring will also be reflected, because your number of attempts will turn from 1 to 2, which will deduct a score from your overall MREE score. Because when you're applying for the universities, MBRU especially has the complete breakdown given very transparently in their website. So they're taking up 35% from the MREE, 35% from your GPA, and 30% for the portfolio. So that 35% of MREE will be calculated based on your percentage, percentile, and number of attempts. So if you're having more than 1 attempt per cycle, it will reflect on your score. But if you are giving it this year, and say if you pass or even if you fail, you're appearing for the next cycle, that means next year, that is 26-27 cycle, then it will not be, this attempt that you give this year will not be counted. I hope that's clear for you. It may be confusing. You can comment down below if you didn't understand how the cycle and the number of attempts work. So that's about understanding the exam before appearing for it, and understanding what you need to learn for the exam. So in my previous video, as I've mentioned about the resources, I've also talked about the MREE blueprint, which is a file which has all the syllabus that they are going to ask for you in the exam. So MREE blueprint gives you a breakdown of the weightage of different subjects. So medicine, pediatrics, OBGYN, surgery, and then you have psychiatry, family medicine, and community medicine. And the percentage and weightage will also be given there. I'll put that down here. So in that case, you have to know how the weightage is going to be, so that you know what all you need to focus on. So if suppose you are completely ignoring OB-GYN, you're going to, you're going to neglect all the questions that come from OB-GYN. That doesn't work. So you have to give enough and equal weightage to different subjects, so that you have an overall concept and idea of all the subjects. Now coming to the actual MCQ solving. So the type of questions that usually appear in EMREE is one is actual fact-based question, very factual question, very straightforward. So they'll give like maybe a clinical scenario or a fact-based thing, and then ask what may be the diagnosis, what is this, or what is the investigation, kind of thing. Or otherwise, there is going to be a clinical stem, and then you are going to get asked three kinds of questions. One is what is the diagnosis? One is what is the next investigation? And one is what is the treatment? Again, in investigation and treatment, there are two kinds of questions. What is the next investigation and what is the best investigation? This is where you most often make mistakes. Usually the next investigation is not always the best investigation, right? Next investigation means the very next step that you have to do. That usually is non-invasive, that usually is very less time consuming and fast, and like more sensitive also. So that is sensitive. What about what is the best investigation? Best investigation is always the gold standard investigation, which sometimes we may not even do. For example, in myocarditis, usually it is going to be a clinical diagnosis. You're going to have ECG changes, you're going to have troponin elevations, and you may diagnose it clinically. What is your best investigation for myocarditis? It's going to be a biopsy, endomyocardial biopsy, but you're not going to do a biopsy to diagnose a myocarditis. That is the difference between the next investigation or next line of management and the best management or best investigation. Again, coming to management or treatment, this again happens because you always have the next line of management, which is usually the very first thing that we'll do to solve their acute problem. For example, in acute gout, what is the main problem? It is pain. So you manage pain in acute gout. How do you manage it? You give NSAIDs, you can give colchicine, you can give, NSAIDs. That is the next line of management. What is the best line of management? Or how do you prevent, or how do you discharge the patient? Often after the acute episode settles, their pain settles, you can give them allopurinol. But that is not what you give in the acute case. So that is the difference. What is next line? What is best? Best means it's always like the end management. For example, in achalasia cardia, you're giving surgery as a definitive management, but you can give other measures before doing a surgery. That becomes your next line of management. So these are the kind of questions: your diagnosis or differential diagnosis. And after you have the differentials, your investigations are tailored to prove that your diagnosis is your diagnosis, or you're trying to rule out your differentials and make sure that your diagnosis is definite. Okay, that is your investigation. Once you have your investigations done, you have your diagnosis clear, you will go for the management. Sometimes, in some cases, you have to intervene first before the investigations come out. For example, I'll tell you an example. Like giant cell arthritis. Giant cell arthritis, one of the dreaded complications is loss of vision, because it can have acute ischemic optic neuropathy, AION, right? So if the patient has jaw claudication, which is one of the most specific symptoms of GCA, that is giant cell arthritis, it's a young female and there is headache and maybe some pain which is localized to the temporal area, and you are hinting towards giant cell arthritis, you are more in line of giant cell arthritis. You don't wait for the loss of vision to happen, or you don't wait for the giant cell arthritis diagnosis to be clear before giving them steroids, because steroids there is life-saving, or in a way it is going to prevent that loss of vision in that patient, which is very, very crucial for as far as the patient is concerned. Because as far as the doctor is concerned, maybe you are more in line for the making the diagnosis, but for when you think from the perspective of patient, it's about their distress, it's about preventing harm to the patient, it's about preventing complications, right? That is why we have the primordial, primary, secondary and tertiary prevention. What is secondary, or early diagnosing and treating? What is tertiary? You are trying to limit the disability. So whatever you can do at a point when you first receive the patient, you have to do. There is something that needs to be done in emergency without waiting for the diagnosis to be clear, right? So those kind of questions you need not mess up. You have to know what you have to do first line and what you have to do, like the best thing that you can do for the patient. So usually it's not the definitive investigation or definitive management that is done first. So first line investigation, first line management are different from best investigation and best management, right? So that you have to keep in mind. This is the first thing that I have to tell, because these are the kind of questions that usually gets repeated, that usually gets wrong by the students. Next, when you solve MCQs, you have to dissect the question. Read the question from first to the last. But once you see a very lengthy question, always start reading from the very end, like the last sentence, because sometimes a question will give you a lengthy clinical stem, and the very final statement will be a very straightforward question, which you can solve even if you didn't read a word from the whole stem. Okay, that is like putting you in a stressful situation and trying to see how do you manage your anxiety, because exam is not just about analyzing how much you know. It's also about putting you into that real life scenario or situation, because in an emergency you are in an adrenaline rush, you are in a stressful situation, so you have to deal that, face it like you are facing a real patient, and then solve the question. So read the last statement. If nothing clicks, start reading the question and see what they are asking, but don't look at the options yet. First, when you read the question, you have to know the diagnosis. Even if the question is not about the diagnosis, make the diagnosis first before going into the investigation, before going into the management. The question may be about investigation, the question may be about management, but make your diagnosis clear, because otherwise you'll mess up from the options, you'll get messed up. Okay, for example, in cardiology, you are having a question. Okay, maybe the question is about pericarditis. Now the question will have what? It'll say ST elevation. Your eyes just striked on that ST elevation and you thought about what? ST elevation MI. What is the management of ST elevation MI? It's going to be early PCI. Percutaneous coronary intervention. You're going to do angioplasty. You are going to revascularize the patient as soon as possible. Okay, you have a door to balloon time and you have a door to needle time, right? Door to balloon time is 90 minutes. You can do it up to 120 minutes. So these are basic protocols that you know. But those ST elevations in the question was about pericarditis, not about ST elevation MI. So you messed up because you didn't make your diagnosis clear before jumping into the conclusion and jumping into the options, because options will definitely have the things that you usually get confused with. So pericarditis, what is the management? It's going to be NSAIDs. You're going to relieve the pain of the patient. Okay, it's usually viral. There are not much else that you can do. You just have to rule out other complications and all. Okay, so the management will differ. So you have to make your diagnosis clear before jumping into the options. And always when you lock one options, make sure other options are definitely wrong, because sometimes there is always a better option. Like for example, there is a complete option say, like you, again, in case of ST elevation MI, the patient is brought to a PHC where you don't have any, facilities, and the patient is within the winter period, and within the winter period itself you are able to transport them to a center where they can get PCI, and the option said referral to a higher center, and another option said referral to a higher center where PCI is available. Now the question is, which option is more correct? Okay, which option is more correct? Referral to a center where PCI is available, because you are referring the patient within that window period. So there can be a better option, there can be a better answer. So always look at all the 4 options or all the 5 options before locking in your options, and make sure that the option other than the one that you've selected are wrong. Okay, always rule out. And if there is an image, because in EMREE there are image based questions, you can get X-ray, you can get images from derma, okay, you can get ECG. Always look at the image also before coming to the options. Read the question, see the image, and then look at the options, because if you first look at the options and then see the image, you're more likely to be biased. You will have one answer already in your mind, and you'll try to frame that question into that answer. You will always get confused, and because your mind will be biased. So do one thing, see the image, see the question before going into the options. And another thing that I want to mention is, before going into the option, if you have one answer in mind, try looking for your answer in the options than trying to find the options and trying to find the answer from the options. Okay, have an answer in mind and try to find that answer from the options than the other way around. It sometimes not always happen, because sometimes there is ruling out, sometimes it's about choosing the best option, but most of the time, if it's a factual question, you know the answer, look for the answer in the option. Okay, that's how it works. So this is how you make yourself fit for solving MCQs, and doesn't come overnight. It doesn't come with just reading the textbook from end to end. It doesn't come with broadening or depth, increasing the depth of your knowledge. It only comes with practice of MCQs. You have to do MCQs in order to solve MCQs. So keep doing MCQs. In the coming days, we'll also be discussing MCQs for EMREE. The first exam is open on December 21st. The next one is Jan 4. So for Jan 4, we have a month left. So whoever is preparing, maybe in a month, we'll have a series happening. So if you have more recommendations on the kind of videos you want to watch on this channel, you can comment down below. And all the best for your exams. Thank you so much.